Yeah. Well, no,
Oh, it
that's
looks
our,
different?
that's our thing. It's actually, it should be in front of you.
Okay.
This is, you
No,
know, there's
it's
been,
it looks like this now because of all of our
Yeah,
new
that's the old
stuff.
I get that.
Yeah.
But we've had a meeting since this one?
Yes, but we did not have a quorum last time, and so you all still have to vote on approving minutes from that meeting, from the time before last.
Got it.
Was it just Frank and I last time?
I think so. I think there were only two of you.
Yes, it was.
Yes,
it was.
just the two of you last time.
Okay.
Okay.
So,
Question,
All right.
thank you.
Let's call this meeting to order. And roll call. Lori Crampton.
Sherry Nestor?
Randy Dubois, did I say, I'm proxy for Doug Lutz tonight.
there you go.
Okay, so we have a quorum. Please rise for the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, do we have any calls to the public? No? Okay. All right. Do I have a motion to approve the minutes from June 25th?
I don't even remember, it's been so long ago.
I wasn't present.
And then just so you know that Kim also included a summary from the last meeting, the discussions at the last meeting, even though there was not a quorum.
You're the only one who's here for it, so.
I move the minutes be approved.
Do I have a second?
I'll second that.
All those in favor? Aye.
Aye.
Opposed? All right, motion carried, minutes approved. 1.6, review and discuss the overall agreement and declaration of the trust.
Madam Chairman,
Yes.
Chairperson, President, whatever. We asked.
How about Lori?
Yeah, hi Lori.
Lori works.
We put this on the agenda because digging through the files for Mr. Flora and me to become much more familiar with the whole process, we found that this is the most recent copy of the Benefits Trust Declaration and Agreement, which is the original document from October 1st, 2014. And so we have sent to you a slightly revised document for your consideration and for some things to be, for you to consider approval of. So for instance, on the first page, changing the date to include revised on December 10th, 2019. And then we've got a couple of items for you to take separate action on, but as you go through, you'll notice that it lists the original trustees. And so, of course, we would recommend that you update that. And then the very back page, which is the acceptance page. Oh, okay, Kim's pointing out this, sorry, the pages are not numbered, but it's in section 3.10. That a word was left out, the word employee was left out,
Okay.
so that paragraph didn't make much sense. And then as we continue, sorry everybody, are you speed reading?
Well, it's the same except for what's in yellow, correct?
Right, everything's the same except what's in yellow. Okay, and then one of the items that we have on your action agenda is section 12.2 that has to do with termination of the trust. And we'll discuss that when we get to it, but essentially we're suggesting that we change that from 90 days written notice to 60 days written notice. And that has to do with timeliness of information from the possible vendors, current and otherwise, to give a little to give a little, if you will, it sounds counterintuitive, but a little bigger window for us to get some things to you as a board, and then perhaps just less time for written notification of changes if we were to make those.
Okay.
And then that page that has is the acceptance page, where we've updated all of those names. There's only one board member for each of the districts that was the same as in 2014, and 3 of the folks changed on the Board of Trustees on this board. So that's an action item as well. But we wanted you to be aware that we could find in both sets of files for the 2 districts no documents any newer than this relative to the trust. That's 5 years. It's time to update it.
Yeah.
Certainly to update names and all those kinds of things. So that's the general part of that.
Okay.
If you will look at section, I have to find it, sorry. If you will look at section 3.10 and section 3.11. So I'm sorry, I'm kind of getting ahead of myself, but I've moved to the next item on your agenda.
Okay.
Okay. Both of those sections refer to a contract administrator.
Mm-hmm.
And at the beginning of this document where there are definitions, there is no definition for a contract administrator. So Mr. Flora and I presumed from the way this read that that was the person that most of us refer to as the broker, or our representative with the insurance companies. And, but that's the only, these are the only 2 sections that refer to that person,
Okay.
or even acknowledge the existence of that position. So, under the assumption that, Laura, you were on the board when it was originally formed, was that who that person was supposed to be?
Mm-hmm.
Okay. So, we would like, Todd and I would like for the Board of Trustees to consider appointing us as joint contract administrators for the time being as we move through this process of updating the consortium and the services offered.
Okay. So, can we go back to the agenda, since
Yes,
I don't have a
please.
written one?
This is really item 1.6.2.
Yeah.
There we go.
So I, see, action, so 1.6.
This is 1.6.2.
Okay.
So for you all to discuss the necessity of retaining a contract administrator mentioned in those 2 sections, and advising us or directing us in those regards, but we are also asking you to consider that we be the contract administrators for the time being. For this year.
We have review and discuss the
Right.
agreement, but we don't have an approval of that agreement on here, so.
It is,
Is it,
is it on down, Kim? For, don't you have a place that says?
Action.
Oh.
The type is action.
Discussion and
Okay.
reports, sorry.
all right, so in
Appointment,
1.6.
approval, and
Oh,
approval.
a motion to
Oh, okay.
appoint, yeah. it's
Just
there.
usually in the statement it says that.
Right.
Okay, so on 1.6, do I have a motion to approve?
Right now, you're just talking about 1.6.2.
Yes, I'm talking just about the document itself.
Contract administrator
No,
is,
we
Oh,
need to do this document first, and then we can go to contract administrator. I like to do one thing at a time, myself. So this document, the updating the trust, declaration of trust and document, on 1.6 over here, can I get a motion to approve the document as it's been changed?
Well, we actually had the 90 days changed to 60 as a separate item, 1.6.3.
Oh, I see, you have it all separate.
And,
All right,
yeah,
I'm
one-
looking over here
I know.
at this.
I'm
Okay.
sorry, 1.6.1 really was not the action part, the next three parts were the action part.
Okay. So. Can you make that motion?
And each one needs to be done separately?
No. You
Well, it
can,
could be, or
you
they
could
don't have to.
approve this document as it's presented.
Yes.
Just make a motion to approve this document as it's presented.
I move to accept this document as presented.
A second.
All those in favor?
Aye.
Aye. Opposed? Motion carries. Now can I have a motion to approve, both, Todd and Carolyn as, administrators of the trust?
Okay, now the contract administrator is again, please define that, what a contract administrator is.
So the definition is not present, but in the paragraph 3.10, it would be responsible for administering the self-funded benefits. Essentially, Dr. Stewart and I, since our arrival, have been doing that and making sure that we're both listening to the employees and their concerns, as well as researching potential options and taking action to potentially move in a new direction if necessary, relative to healthcare, vision, and dental. So that term, contract administrator, essentially has been taken over by Carolyn and I since we've been here. This is an old agreement and it's not really been addressed, which is why I think we're bringing the term to your attention, because it's not defined in the initial section of the agreement.
So they don't want the contract administrator just to mean the insurance broker, which it doesn't say in here.
It doesn't.
But that's who it's been. That's who it's been up to now. I'm the only person here sitting up here that's been here from 2014 to now, so.
And I think Dr. Stewart and I'm speaking for her. I'm
Crazy,
sure
the crazy
agree,
person,
is
right?
We don't want the trust to relinquish that control. I believe that Carolyn and I both have the employees and the district's best interests at heart in terms of the funding and the programs that are available to our employee, and believe that combined we represent the best contract administrator for this purpose.
I am not doubting that at all. I think
It
you're
doesn't
all
mean that,
crazy.
it doesn't mean they don't work with the
Define it.
insurance
It
broker, it
didn't sound
doesn't mean
that
that
way.
at
We
all,
work
it just
with-
means
Didn't
they
sound
also
that way.
are contract administrators.
You didn't sound that way.
Yeah.
No, and I was trying to define what I perceived as
You
my
guys don't
role.
have enough to do?
My role as, this is important to us. Dr. Stewart and I recognized right from the onset, and with thanks to the help of our staff, have brought to our attention concerns that we know need to be addressed, and we have been
Wow.
addressing them. So while we have a lot on our plate, this is an important thing.
Yours
that's
truly
on our
said from the beginning, Aetna doesn't work out here.
Yeah.
Aetna's a tough thing out here.
Right.
It works really well in Maricopa and Pinell and Pima, but it does not work out here. I personally had Aetna before and said when we were gonna move to that, this is not a good thing for our employees. There are not enough providers. There are not enough, and in being assured all of those things, I mean, I don't know, 9 months, 10 months later, there still wasn't a single radiologist in our town that was a provider on Aetna. So it's, and a lot of people have bills over that. So, it's a problem. Aetna's a problem for us here.
And I think it's safe to say that Todd and I, neither one want to do this perpetually.
No.
That this is a transition. We both sat in the last 2 meetings, and we've heard the concerns of employees. We've worked really closely with Michelle and John on trying to address some of those concerns. Todd has personally experienced some of the frustrations that our employees face, and because it's important, we really felt we should take it on, at least temporarily, until perhaps we can get things straightened out.
Okay.
That's our intent, not forever.
Do I have a motion?
I move that we, where's the, I move that we accept Todd Flora and Carolyn Stewart as contract administrators for,
As listed in this contract.
as listed in this document.
Do I have a second?
I second.
All those in favor?
Aye.
Opposed? Motion carries.
Thank you. That will help us move forward with some things that we need to be doing.
Okay. 1.7, possible insurance carriers and vendors for FY '21.
Do we need to go back to,
No, we
You
combined them all
include- you
together.
included those in your overall.
the 60 days and,
Mhm.
okay,
Yeah,
Thank you.
we did them in one fell swoop.
fine. I just didn't know if we needed to separate them and do each one separately.
You can do that.
To make it
You can
legal.
do them combined.
Okay.
Okay, on this one, Madam President, this is gonna be fairly general. Originally, Todd and I thought we would be in a position to have some folks here to give comparison presentations for the next year.
Where's
So we're
Mr.
not
Stewart?
quite there.
Do we know him?
We don't know.
Mr. Stewart?
He was invited, he knew to be, he knew he could be here and he saw the agenda, so. So essentially, this is an update, and Todd and I have not had a chance to talk today, so, to each other, but we have talked about this in the past, so I'm going to give you some information, and then he may add to that. First of all, I want you to know we've been doing due diligence. That has been a real key for us in terms of digging out information. And the first thing that I will tell you is probably not a surprise to you. You might mentally go, duh. Insurance is out of control. There is not much regulation of it, and insurance companies are just kind of going crazy. And I don't imagine Chuck would even disagree with that, because he's kind of a person who works with those folks too. He's not actually with the insurance company itself, so I think he probably would second that. So we're finding ourselves with all of the comparisons that we've been trying to do, kind of seeing that what we're going to be trying to bring to you next month is the best of the undesirable. There are not good choices. Okay?
I think we knew that.
I think you did. That's why I said this is probably a duh for everybody. So the other thing that we need to say, and not just for the trustees, but for the reps from the school sites, we're sorry about that, but we've been up to our eyeballs in this information, and there are not good choices. So we're going to try to bring to the board, to the trustees.
And by that, you don't mean not good choices for their healthcare, you
No,
mean the pricing.
The pricing.
Yeah.
Yes, that's what I mean, not the service, but the pricing.
Yeah, we've met with about 4 or 5, is it 5? Different? Several, and, you know, none of them had good price. I think the staff knows we've been diligently working on this and researching it, and I don't want to jump ahead of you, but we wanted to bring them today, but we had, and we're listening to the questions of our employees, and we said, we need more information. So if we asked 15 or 20 questions, there were 100 that we needed to be asking. So we're doubling back now. Before we bring anybody before you, we want to make sure that we've dotted every I and crossed every T, so that we are going to limit who we present to you as what we believe is the best option out there. I don't know if I jumped ahead of you there.
No, you're in good shape. The next thing, which is probably also a duh, but it's something none of us wants to hear, no company is going to decrease rates. Everybody's going up. The best estimates we have are 7 to 14%. I don't know if Chuck's in a position to know any of that, but that's what we're getting from the industry, is that 7 to 14% increases in general health insurance. And so we're looking at numbers, since we're paying right now $10,000 a year for medical insurance for every full-time employee for both districts. That to even hold that line or be close to that We may have to do what some others have done out there, which is say to employees, okay, we're going to fund to X level. It might be the current 10,000, it might be whatever it is you all decide, but we may have to go to them and say, but you're gonna have to chip in some. Maybe for some of the supplementals, we don't know. But it's a very involved process, and Todd is not really exaggerating when he says 100 questions, because we've been going back to them with questions and questions. And our intent is to present to you all a list next month of here are the things we want in the plan, based on what employees are telling us and what we already know we need to have in the plan, and then bring probably the 2 best options so you can see where do these options fit with this list of what we need to have.
And what are they saying that they want in the plan?
Oh my gosh, well, what we currently
Because
have.
maybe they have a higher
that's-
deductible and maybe they don't pay for the plan. I mean,
Exactly. And that's
I
part
don't
of
want
what
to
they
charge
need to know.
employees for a plan. I'm
And we'd
very
rather not.
adamant about that. I think we have to figure out a way not to charge them money for a plan. I think we're working really hard to pay them more money and then we're gonna make them pay for their insurance. It's kind of redundant.
And I think that's one of the things that you all will need to discuss, because I think we need to have options both ways. I think we need to have the low deductible and some copay, and I think we need to have another option available as well, at least one other option. We've always had at least 3 options.
Right.
So we don't want to limit the
Right, so they
board
can
to
pick
those
too.
decisions.
And if they want a better plan, then they
Exactly.
can pay if
Exactly.
they want this better.
Exactly.
If they want a, not better plan, but you know what I mean, a gold standard plan where they have a lower deductible or a.
So we want to bring those kinds of options to you
Okay.
next month and whatever. And I want to finish this kind of, and if Todd has anything to add,
Okay.
but then we want the people in the room to also ask some questions and say what their priorities are.
Okay.
Michelle and John have been trying to work from the priorities that were discussed at the last couple of meetings, but we know that there are other things out there, so we want to add those questions to our list. I will tell you that in the process, we have gained some encouraging information simply by asking lots of questions. So one of the things that many of us didn't know, me included, even though I've been in the process for years and years and years, is that we can do services shopping as employees. So if we need something provided, so I'll just use an example of I'm told that I need to have a surgery. My doctor says you need to have this surgery and I want to do this soon. A question I never would have thought to ask my doctor is, do you have privileges at more than one hospital? And if my doctor says yes, I'm going to shop those hospitals to see what the rate is at that hospital.
Right.
I didn't know I could do that.
Yeah, I send
Okay.
people to Mountain Imaging and Kingman all the time because it's way less expensive and their copays are so much lower.
And most
I mean, I
of
have a
us
stack
do
of
not
their
know.
cards and I say, oh, yeah, you're gonna pay like, it's like a third of the price for an MRI in Kingman. If you're willing to drive, you're gonna have a very low copay.
Well, and many of us didn't know that.
Yeah.
So we now know that we can do that, but we also know that our benefits people can start working on a list for our employees of, if you need this done,
Yeah.
here's where you get the better rate. If you need this done,
Mountain
here's where you
Imaging.
get the better rate. The other thing we learned is that if you pay electricity through MEC, if you're part of MEC Cooperative and you have the little discount card,
Right.
you can get your vision care taken care of way better than our vision plan allows. And in fact, Michelle has said to us, anybody who has MEC should
I
consider
would never
paying for
advise
that
an
plan.
employee with the MEC co-op card to ever pay for a family member or for the extra plan, because it's the same or better as a free service through the co-op.
Wow. I never even use my co-op card when I go to the eye doctor, so that's really great information for
So,
me.
yeah, so we're now learning, I mean, that's one of the things that's coming about with all of this due diligence is we're learning a whole lot of information that benefits our employees that we didn't even know we had available. John has something relative
Well,
to
I
that?
was gonna say, I got a brand new pair of glasses and they're online. It was a lot cheaper than even going, attempting to go use our vision.
Well, they show you what they look like online. My girlfriend got her glasses for
Yes.
$60,
Yes.
and they're beautiful. I was like, oh, I love your glasses, $60. She tried them on, like 20 pairs on online and ordered them for $60.
You have to be careful though if you have
To
astigmatism
pay.
and stuff.
Oh, I'm sure.
Because I ordered mine and,
Yeah, I think if you have anything like that, you couldn't do it.
but I
But
will,
you're still paying the vision, with the vision insurance we have, you still pay just twice as much. It's like, it's ridiculous.
Yeah.
I need a pair of glasses on, for my eyes, was $360. I'm like, "Forget
Yeah,
it."
my daughter used that insurance when
Well,
she worked for the elementary district.
Co-op plan is not something where you have to buy your frames online. You can actually go into Sam's Club or Walmart or any place that accepts it, and you say, you know, okay, I have Mojave Co-op, what's my price? And it's very similar to what we have as our vision plan right now, at no cost.
And the thing is that we're paying for that plan for 100% of our full-time employees. And number one, Michelle tells me very few of our employees actually use our plan. So we're paying for something that very few employees use. And secondly, that anybody who does use it could get for almost nothing with their NEC card.
But you
So I mean,
can-
that's just a fallout point. It's not
Yeah.
one that to discuss tonight necessarily, but I'm using that as an example of the good things we're finding as we're doing this research.
Which
Yes.
I
is
can't do that though, because I live up in Point de Vista and my electricity is not MEC.
Right.
I
Right.
have Unisource, so we can't get rid of it completely because.
No, and we're not suggesting to get rid of it completely. But the thing is that it's the kind of thing that we would only need to pay for as a district for those who are not on the co-op, for example. I mean, that's that's open for consideration and discussion because
Yeah.
it's an option. We have options that we didn't know we had.
Yeah, that's a lot of
And
money.
that's beneficial.
I was gonna say, one of the other things that we found in our research, and it adds to the questions, is you have single, married, and family. And then on another plan, you just have single and family, or single, it's hard to compare apples to apples when each of them are showing you something different.
Right.
And you really have to line things up to see how they match. And I think that's part of the game in the insurance world is, oh, well, we're gonna offer you this copay, but then you have this deductible. And I do know that the board, long before we arrived, was not a big fan of the high deductible programs and those types of things.
Well, they couldn't afford it.
Right, well, it's exactly, they're expensive, and then in the end.
And like 6 people had it.
Well, the biggest thing that I heard, and I, as Carolyn.
2 people had it. 2 people had the high deductible plan.
And Carolyn alluded to the fact that I experienced this, and Michelle was very helpful, by the way, in getting me through this. But, you say you're in network, I check you're in network, you charge me the in-network deductible, and then I'm getting a bill for $300, and I'm like, what's this all about? So we're trying to work with the walk-in clinics, we're trying to work with the dial-in service that you can get that'll help to lower costs, as well as finding out, who is and who isn't within the hospital structure.
Well, just because the hospital's in network doesn't mean the physician
Exactly.
is.
And so we're looking
Doesn't
for-
mean the radiologist is, doesn't
Right.
mean, and they don't post it.
However, those
Well-
claims, every time I have brought one this last year to Meritain to
Yeah,
say,
they will pay it.
yes, they
Yeah,
are
I tell everyone,
reprocessing
write
it
a
as
letter, they will
in-network.
pay it. If
Yes.
you go there and it's an emergency, they will pay it.
Right.
But if you have to do the work,
Yes,
yeah.
otherwise
Speaking
no
of-
payment.
Speaking of the work, and I'll say for both Michelle and John, some of the companies that we've been meeting with are now, I'd say, modernizing the process of open enrollment. And so, we're still in the Stone Age when we hand out, 150-page packets to 450 employees, when what we'd like to do is create a relationship with some of these companies that are digitalizing the process, which would greatly reduce the amount of time and energy that Michelle and John are spending by digitalizing all of the records. That just year after year, and we're hopeful that we can do this prior to the next open enrollment, to not inundate all the employees and John and Michelle with this burdensome task of handing out these packets. where we're filling out our name and our address and our social security number ad nauseum over and over and over on 47 pages.
When we already have that on them, especially existing employees.
Right, but I'm saying every year in the open
But every
enrollment,
year
if you
we have
change
to do
that
it,
plan,
put it
they
in
need, and most of them are changing that, other documents, and we would rather have, and we've spoken to about 3 of the 5 that are willing to and have digital processes whereby they would lift that burden off of John and Michelle. Also, the questions and the concerns that are raised by our employees would be handled by them and not John and Michelle. That's something that was music to their ears, and don't let me speak for you, but I know you were smiling when they spoke. Just because it's taxing and it's time consuming, and if we're paying a fee for a service, then provide a service. Give us those, provide us that assistance. They should be calling, not Michelle.
Well, for me, it's not so much the time or effort. I absolutely do not mind that at all. However, on the employee's behalf, they may not want to share personal information with me
Right,
or
good
private
point.
health
Because
information that I am then conveying.
yeah, because they know you, and that might be
Yes.
uncomfortable.
But, and also, I may have a different, somebody may feel one way with me versus with a male, or one way with a male versus a female. And so, in order to get them to just the person that they need to speak to, so they don't have to include me in their personal information, would be good for them.
And that's a very good point, because my issue was relative to a cough. I had no problem sharing that with Michelle, but you're right. It gets sensitive on other levels and in different situations. So.
Yeah, that wouldn't be comfortable. They shouldn't have to tell their
It can
local
be very
benefits
awkward for
person
them, and
anything about
I
their
don't need to
healthcare.
know as much information as I do about half of them.
We should be able just to direct them on where to get the answers from, and not be the one.
Yeah, because I'm the contract administrator at my work, and I know nothing about my people's health care. They have someone else they call. I don't want to know about their health care.
You know, that's something for most.
Well, and the reality is that some folks might be more willing to actually get health care
Yeah,
if they know they don't have to share personal information
yeah,
with somebody that they know,
right.
you know?
Now, sometimes they
It's
ask me
just
for help with
awkward
a
and
claim,
uncomfortable.
but other than that,
Right, right.
nobody asks me anything.
I don't want people to know I'm losing my hair, my mind, and my eyesight, so I want to keep that a secret.
In that order?
I think we know.
So in that sense, we just didn't want to, we knew that the next regular
hearing.
meeting was scheduled for January. We didn't want to blindside the trustees, the board of trustees, with, or other employees with this humongous amount of information that we're going to bring next month. Now, we may not bring it, but we'll have the people here who will bring it for you. And we will have the tables for comparison and for you to look at all the work as a result of the due diligence that we've been doing, so that you can make a really informed decision. But we were really concerned about just saying, okay, we're going to have these data for you next month, and not having you have a heads up that it's going to be cumbersome probably, and fairly complicated, because we found that it's more complicated than even we thought it was. You know, but to try to have it in a format and documents that are pretty accessible to understand and reasonable, and for you to know that we have really narrowed it down to, in terms of cost and cost benefits and those things, narrowed it down to the best that we can find for our employees.
And what, who are you looking at?
Well, we're looking, of course, at our current providers,
Mhm.
because we hear some good things about our providers. We went back through the minutes and heard that a lot of the complaints didn't have to do with the providers so much as with the whole game of the walk-in clinic and some of the other things, like the not knowing what you're getting charged for a similar service. So those things that have to do with service shopping,
Well, and
knowing those things. So
some of
current
these
providers.
walk-in clinics that are opening they're not getting their own tax ID. So what's happening is people are going, and then you're getting charged a copay for like an urgent care, but then you're getting an ER like visit.
Right,
And it's happened to me too. And
Right.
so it's actually fraud.
it
And
is.
you gotta use those words with them. It's actually fraud. they have to have their own standalone, and so the thing that kills it is the place of service code, and that's what you wanna know on their UB, I can't think of the number off the top of my head, their UB whatever form, is what's your place of service code? Because their place of service code should say in urgent care. But it probably doesn't, because they're using the tax ID code from whatever hospital that's opening it up. And that's your, you know, my son once had an $1,800 sore throat on the Parkway when they opened the one up there, and I was like, I paid my $60 urgent care copay, and that is exactly what your problem is. It's at
Right.
your urgent cares.
And we wanna make sure that we've got all those things, you know, all those
They're
things
like heck
in-
to fight, they'll, you know, they
Exactly.
really are tough to fight.
Exactly. So, and the other provider that we will
That's not the
bring you-
insurance company.
No, that is not.
No.
We will also bring to you information from Kairos, and that's spelled Kairos. And that's a fairly new group. They formed in 2017, and this is an offshoot of Arizona Risk Retention Trust. So we've been working with them to get information, and we've been seeking information from our current providers, directly from them, so directly from Chuck and directly from the current providers, so that we can put together a comparison of services for y'all. Todd and I have been impressed with Kairos and the idea that we're a member, like we are a member of the trust. However, we want to make sure that we're doing the best for our employees, so.
Who administrates the claims?
They do,
They do.
yeah. They
And
do.
what's their insurance? Like what's their?
Right now, they have Blue Cross Blue Shield
Okay.
for
Well,
the
everybody takes
insurance.
Blue Cross Blue Shield. That's way
And,
better for.
and then they
out here
also
than-
have, they have the same dental?
No, Delta
No.
Dental versus.
Different dental, but the same vision and, no, different
BSP
vision.
versus Vision Care Direct.
Okay,
Yeah,
so that's another reason that we want all these comparisons, because we're getting, you know, we have different comparisons of the different companies. That has led to lots of questions. We had lots of questions for them, which they answered, but that also then led to more questions, and Michelle and John have been pumping out questions like popcorn almost, and that's a good thing. That's a good thing. So.
And I was gonna say, we don't wanna inundate you with all these charts and
No.
some of the research.
Not tonight.
What we thought would be best is to have the experts come and actually share their expertise with you. I brought up on my phone,
But then I'll actually want those charts.
well,
Oh,
we'll get them to you in
We'll have it
advance.
next month.
We'll
Okay.
get them to you in advance
Okay.
of the meeting, so that you can look at them.
Okay.
But then when they arrive and begin to explain them, you may have had circled or identified or highlighted some concerns you had. While we were talking, I brought up an email that kind of bounced around some of the employees' concerns, but it's mostly about deductibles and meeting them, and in a employee spouse arrangement, meeting those premiums and deductibles, and all of these things relative to remember I was saying one of them was had single, married, and family, but others don't. So it's really hard to compare one that does that to one that doesn't. That was a set of questions, and then there were some additional ones relative to clinics and things like that. Also the call-in services. So we're really, over the last, I don't know, 3 months, I think, have seen and heard everybody's sales pitch, everybody's best option available. I think the biggest concern, and the reason why we want to go back and talk to our current providers, is what are you going to do for us? You've been with us, we've been working with you. Before we leap, we want to hear what you and have them present, so that they can talk to us about the things we think they might be able to fix. And then let the board of trustees to make a decision based on all the information that you'll have before you.
And we've actually gone back to them. I mean, Kairos gave us a table. We've had the table for this year from our current providers. Well, you can't really compare those because it's 2 different years. But here's what we've done. We've gone back to Kairos and said, no, we want you to change some of this. We should be in control. You all should be in control of this, not the other way around, as much as possible. So, you know, we want you to give us your best shot at this wish list. And we would say the same thing to our current providers. We want you to give us your best shot at this wish list that's coming from our employees, not the other way around. Not them saying, okay, here's the best we can do for you.
Here's
Well,
what
I'm
you get.
sorry, it doesn't, you know, here's what you get, here are the choices you get. No, if you want our business, here's our wish list. Give us your best shot or your closest thing to this so that we can get as close to an even comparison as we possibly can.
One other missing variable is, based on our experience, we don't have a fixed number as to what our premium increase will be. And so that's an X factor that we need.
What's our loss ratio this year?
Before we make that
Right
decision.
now, you're at about 98% loss ratio.
And
Last year for renewal, you were at it was 86.8%, was your overall loss ratio. So you're a little bit higher than where you were.
Yeah, but I was disappointed with our rates last year with us
Well, I know,
at
yeah.
86.8, so that was extremely disappointing.
Yeah.
And it's concerning because when you're at that rate and the rates are going up, and what are they gonna be? So the
Yeah.
reason I mention that is because
So we have
until we get that
13%
firm-
more, so what's it gonna be?
Right. Well, you made a great point, is you have the power, I mean, to shop and say, this is what we're gonna do.
Yeah.
And for
Yeah,
me
and
to-
last year was like a blow.
and for me to go back, and if you think about it, 2 years ago, you had a 25% rate increase. The year
Yeah.
before, you had an 18% rate increase.
Yeah.
I mean, your loss ratios have improved, but at the same time, you still have some big claims out there
Yeah.
that yes, they're being paid, but when the underwriters look at it, they're doing their math that says, oh, well, this is what the insurance needs to, for this year in regards to an increase. But going back and saying, we're shopping it, we need a best and final no matter what by January 30th or whatever day, you're all talking about. I think that's a good strategy.
Yeah.
Because I can go back to underwriting and say, what are we gonna do? Because they are ready to go. And I know a lot of the stuff that you've brought up in regards to services and talking, instead of talking with Michelle and John, we've got our customer service reps, we've got our client advocates, and then our account managers that are available. So again, we want them to be directed to our team as opposed to Michelle or John having to answer. So we have all this. We want to be able to present
Well,
it
all the promises about the Aetna
Yes.
providers weren't met.
Well,
They weren't. I mean, we didn't even have an Aetna radiology person in the entire town for months. And when I spoke to Nancy Kelly, no one
Right.
ever approached her. So,
well, there are, and I can see that absolutely.
no, I mean, that's the
Yeah,
truth.
right,
That's what
right.
happened. So,
Absolutely, it does happen.
and it's
There's
like,
also, there's
and
also,
they're the radiologists for both hospitals and no one ever called them.
right, there are also physicians out there that just don't want a contract.
Absolutely.
Because they know they'll make more money
Yeah, but
because
if,
it's a rural area.
no one ever even asks,
Yeah, oh, I know, absolutely. No, I absolutely agree with you.
I
I
no one
absolutely
ever
agree
even
with you.
asks.
And Madam President, one of the things I will tell you is that in this process, we've had difficulty getting folks to even talk to us because of our risk ratio, our risk
Absolutely.
ratio.
For sure.
And partly because our employee pool is so small.
Yeah,
We're talking 490 people.
right.
So if
And you
we
don't
can
think
talk,
that's small, but it's small.
it's very small.
Yeah.
And if we can get conversations with folks who will put us in a pool of a larger pool. So
Right.
a 20,000 member pool as opposed to 490. If we could even be in a pool that was 1,000, but part of the reason they wouldn't talk to us is because of those risk ratios that
Right.
we've had for the past 3 years. And so we felt pretty good about the fact that we could even get 5.
Well, it
Current
is
one and
good
4 others to even talk to
because
us.
we tried a
Of
couple
course.
years ago and no one would speak to us because we were what, I mean, we've
Because you're at
improved.
150, I think
Yeah.
you're at 150, 160 loss
Yeah,
ratio.
160% or
Yeah,
something.
I
It
mean,
was
it was-
horrible.
it
No
was
one would
horrible.
even talk to us. And that was the first year we thought about becoming self-funded maybe even. And then we had the 160 year and it was like, yeah, you guys are
Yeah, so.
crazy. We can't do anything. That's, no, I mean, we're gonna be lucky that we have anything.
Well, we're feeling pretty good about the fact that we have.
That people are talking to is
and that we're,
fantastic.
You know, that we
Yeah.
can actually come down with something.
Who
Current-
else
current folks,
besides
so-
Aetna and this Caros?
I can't remember the names of the
You're
other,
looking at me,
I'm sorry,
I
I don't
have
have those
their-
notes in front of me,
Okay.
but.
yeah, we were looking to really bring all,
Okay,
the
I
other
was
two,
just
I
asking.
will say the other two.
I was just asking just because, you
That's a
know,
good question.
just
You
for
know.
me too, it was
We're
really
trying to
about
kind of
provide
balance it.
about the insurance it provides because I just know Blue Cross Blue Shield is a much better user-friendly insurance for our employees than out here than Aetna is. Because personally, I had Aetna for
I'll
1
get the
year.
information for you, Sherry.
And then I said, oh, I might be saving some money, but this is not worth it because Aetna was not good for me out here.
I
So,
think both your personal and your professional experience really help educate this trust, because you know, and working knowledge, you know, within your line of work and your husband as well. My dad being a doctor, I tell you, he got out of practicing medicine because this insurance game has really gotten to be crazy.
well,
We could have the
concierge
greatest-
medicine is on the rise.
And we have the greatest experience, and rates will just go up regardless.
Yeah.
And when they do their math, as you mentioned, that math includes more and more profit, more and more, you know,
Well-
gains. And it's, our experience sometimes is not as relevant as it used to be.
Right.
It's becoming a game of, and I think it really does boil down to, we just want our employees to have options, better pricing, and then we'll have to figure out the financing. You know, I was gonna joke and say, we just won't pay any of our board members anymore, and that'll help pay for it, but.
I already don't get very much.
The reality is, we may have to look at other options, as Carolyn alluded to. Back east, back in New Jersey, the legislature changed the law. It was a 33% contribution by the employee to the premium. And, you know, it was just because the premiums back east are even higher. I mean, we were seeing
Yeah,
25.
but they get paid a lot higher too.
We did get paid a lot higher, so I'm not
The entire
suggesting
cost of
that,
living's
but
higher.
maybe when we look at a vision option not being part of that, or maybe dental and making those optional, these are decisions the trust would make, and I think you should wait and hear all of the presentations before we even go down that road. And then Carolyn and I think both as your new administrators, looking at other ways to look at our revenue streams and our expenditures to do everything we can to contribute to the best possible plan for the staff.
Well, we actually pick the plans, but actually our individual boards pick what they're gonna fund for their school districts.
Right,
We don't pick that.
right.
Well, but because you have representatives from the boards on those folks' opinions, certainly, I would
They
hope
certainly
would
matter.
carry some weight.
They certainly
In
do,
terms of the
but we don't,
recommendations.
we've never decided here what the boards pick. I mean,
Okay.
we've picked the plans they choose from and such, but we can't bind the boards to
To the funding,
financial.
okay.
Yeah, they
Yeah.
pick,
And
like
again-
if they're gonna cut funding or find funding or do whatever, they have to decide that.
And bottom line is, we all know that there will be a price, and you two sometime, some way, have to fund it.
We'll figure it out.
And,
Exactly.
which may mean a cut of services within each district, a cut in personnel, but coming up with an extra $5,000 a month to fund the health insurance, this is not an unending source of revenue, folks.
No,
No,
Something, if at that price, will have to go.
have to go.
right, exactly.
I am fortunate, again, to have you, Madam President, on my board, along with two other physicians, and just the knowledge of how this all works. And
It helps.
it does, it helps. I'm not having to first educate the board knows.
They know, and most of us that are on the board, several of us, buy our own insurance. So like my husband and I didn't even meet our deductibles and our insurance went up. We didn't even use our insurance that much this year and our premiums went up. And so, I mean, we pay right now $2,310 a month for 3 people. And we have a huge deductible. I mean, we're contemplating me getting another job outside of our office to just have health care because it's crazy money. That's crazy money. He's like, I think you gotta go back to your old career just to get health insurance for us. And that went up.
Right.
I mean, that is crazy money. That's a salary.
Well, that was the premium.
That's almost what I made my old job before I quit working before I had kids. I was
And
like,
the thing is that nobody can afford to not have.
no, you
insurance.
can't afford to not.
You know, I mean, that sounds outrageous, but the thought of what we might have to pay, that anybody would have to
But
pay
think
if
about
they
it,
did
that
not
is,
have
that is
insurance.
almost $800 a person, and that's what Blue Cross Blue Shield is. That's what we pay. All $793 a person or something, that's what we're paying. And it's a PPO group plan, but we're a small group. We only have 3 people participating because who else can afford it? I will pay 50% of your plan at my office, but I can't afford to pay any more than that. So, yeah.
I know that Michelle and John would like the reps from the schools to talk about whatever questions they might have that get added to this list, this wish list. And one of the things, so throw them out there and then Michelle and John can say, we have an answer to that question, or they can say, great question, we'll add that to the list.
Yes.
Can we ask, why the, prescriptions are continuing to go up? For like, we spoke last time and nothing never changed, and I
I
emailed
know
you
you
twice.
sent, yep, you sent notes.
Nothing ever changed, but my prescriptions that I have to go pick up tonight at CVS used to cost me $13, and now I'm paying $36 for 2 prescriptions. Same thing, nothing changed except for the cost of them. And you said that the carrier, whoever our prescription people is, went through the most commonly used
Right.
prescriptions and raised the rates on all of them.
They changed their formulary, and they went through a process of, and again, this is on the pharmacy carrier. So they went through a process of looking at what's out there, what's also out there on a generic basis.
Oh, mine are all generic, and they
Okay,
still went up that much.
and they still went up that much?
Everything is
Okay.
generic that I
Because they're
take.
gonna say they want steerage towards generic to help
Everything's
save
always been
everybody
generic.
money.
Yep.
But you're already taking generic,
Yep.
right?
Michelle, you learned some things about that, about prescription shopping?
Well, I do know that there are instances, well, for me, I went to Walmart to pick up a prescription, because you do know that if you got this prescription and didn't go through your insurance, and we did 90 days, it would only cost you $10. And I was like,
I
oh,
tried the GoodRx.
sign me up, you know.
The
Well,
GoodRx, but mine's still like,
Yeah,
the
it just-
generic on GoodRx, it's still cheaper to use my insurance than it was to go self-pay.
And you can call around to different pharmacies, and it's kind of like gasoline. It's very strange. It depends on
Each
what
pharmacy
they
has a
have in
different
stock,
contract.
Yeah.
which provider gave them those pills, what they paid for that lot. You know what I mean?
It
So it
is.
can change. Now I understand. People
And if it's 30 days or 90 days.
Yes, and I don't want to call a new pharmacy every month and transfer my prescription everywhere. I get that, but I also can't. If it's a difference of $75 and $7, you can bet I'm going to be called. You know, it just depends on what it is, but everything is coming into play. Everything comes into play, and I have such a hard time when I have an employee who says, I can't even afford the $40 to go to a doctor visit, let alone worry about a deductible or anything else, right? So I say, hey, use Teladoc, and by the way, our numbers are up quite a bit for that versus last year, you know, I can watch that. So they're making use of it, and then they're getting the prescription, but again, you can't have the prices be too high, so we have to be mindful of that, and where can we get these generics, and where can we, you know, how can we get better prices for them? Because your whole flu wipes through your family, there goes your Christmas,
Yeah,
because everybody was sick for 3 days. I mean, it's terrible.
yeah.
Sherry kind of knows some of the prescription stuff. Do you have any answer to that?
No, it is who you're, and wholesale houses use different vendors because they get it at the cheapest, and it can vary from month to month.
Like I have a script that at CVS costs $300 a month, and at Safeway with the GoodRx card, it costs me $27.
Yeah,
So that's a huge
I need
difference.
to shop one on the GoodRx right now, but I have a prescription that I've taken for 20 years.
Right.
And I'm not willing to change because it eliminated my severe migraine headaches when I went on this blood pressure medicine. So
Right.
I'm like, no way, I gotta keep taking this one. I paid a $60 copay, and now I went to pick it up and they were like $363, and I said, what? And so then the pharmacist is like, yeah, it's this milligram. And so he goes, well, if you get 2 180 milligram pills, it goes down to $153. And I was like, okay, I'll take that option. But I'm still like $153. So same thing. I'm like, I gotta go shop the GoodRx option on this drug, because who goes from $60 to 300 and something on a drug I've literally taken for 20 years? 20 years.
That's your situation.
Well,
Yeah,
But
20
it
years.
keeps changing.
No, well, but it didn't though, and like you said, from month to month it'll change.
Yeah.
It didn't. It was the same.
Yeah, 20 years.
Forever.
Same drug, 60
And then all of a sudden, all of them went up.
But it did used to be $20, and
I
it
will
went to
say this,
$60.
that sometimes they're caused by a shortage of materials.
Yeah.
Whatever is
and the
in it.
pharmacy will tell us. The
Yeah.
pharmacy will tell me, because then they'll have a hard time filling it. And I know that to be true from my Maddie who takes medication. The 10X is difficult to get. And I have to like pharmacy hop. I feel like a drug seeker. Pharmacy hopping. And I mean, really, that's what you feel like. You feel like a drug seeker, and you're like,
Yeah.
oh, I'm going to show up on some red list, and I'm going to walk in, and there's going to be the
Oh.
FDA and
Yeah.
all these people. But, you know, so they'll tell you when it's limited. But this was all just, you know, the insurance that, you know. So if you can check with
Yeah.
the other insurance companies
Well,
and see
your husband used to be
what
the
is
only,
their
like the only guy in town who
generic
did
prescription
compound.
costs.
Yeah.
Right.
Now nobody does
Well, that's
compounding.
what it was. I mean,
The
that
one
was-
guy
they
that
did
did
change
compounding
their-
just closed down.
Their
Now D-Flat, I
pharmacy
hear, is doing some
program
compounding.
changed, so
I
that's
always
how
say
they
that-
got caught up in that.
I know we all have experiences.
What's his
I'll
name?
share with
He
you
would do
one that my copay is $40 for a prescription, but if I contact the manufacturer, they offer one of those, you know, and they send it to me right on my phone, and I give that to the pharmacist, and all of a sudden it's $5.
Right.
And I'm like, so I'm paying this premium for prescription meds. It's a 90-day supply. It costs $40 as my copay.
Yeah, that's only name brand drugs though.
But it's not necessarily, because manufacturers, and I'll mention one like AstraZeneca, may be able to help, right?
Yeah.
I sound like a commercial, but boy, they send me something and it comes right to my phone. I give
I
that
have
to the
one too.
pharmacist, they punch in that BPN code, and bam, it's $5.
Yeah.
And I was like, how is that?
Because you're getting the discount instead of the insurance company.
Exactly.
Right.
And so it's just a
I
crazy.
have one of those too.
crazy-
$5 one.
So then we need to
Be
find
sure you
that.
ask them what the cash price is, just like Michelle said.
Right, what is the cash price? Because
What is the cash price?
Sometimes I've seen like certain places where
And the cash price is always
antibiotics
cheaper at
are
Walmart.
free. You know, I think Safeway up in Flagstaff had where antibiotics were free during, you know, the month of December or January. And it was amazing, because if I used my insurance, it was $40, but if I said I didn't have any insurance, it was free.
All of my medications now are all generic, and I pay cash, and they are less than a copay.
Hmm.
So ask about that cash price.
And tell other employees that.
Yeah,
Because
I
that's
think
part of,
back.
that's part of this whole thing is, and part of what we're hoping. that
Sometimes
Michelle
cash
and
is
John-
cheaper than GoodRx.
Yeah, and that Michelle and John can put together, you know, just like that list of, okay, where's the least expensive places in our network to get an MRI? Where's the least expensive place to get a dental x-ray? You know, if we can put together those kinds of lists to help our employees. Because first of all, if you need the meds now, you don't have time to shop. If you need the
Well,
service
and when you're
now,
sick, who
you don't
wants to
have-
shop? You just
Exactly.
wanna go.
You wanna know, so if we can, you know, build this, index, if you will, of information about our employees, that will be a good thing too. So, you know, that's part of what we want. Great question.
A lot of that you can post onto if you're gonna do a digital web portal where you can actually enroll into all your benefits. You can actually have that where there's a community where
Yeah.
everybody's sharing that information as well.
And who has the best cash price for what drug? I
Right.
would even list it by drug
Sure.
because, you know, yeah. Lance?
Kim, do you want us to use the podium for minutes?
If you want, that doesn't matter. I can pick it up. It picks up.
Um,
Thank you.
As Lori mentioned, one of the big challenges we had with Aetna when we switched networks was just there was so much outreach in, credentialing outreach in Phoenix and Tucson and other areas that this area was sort of overlooked. So I have a specialist that I saw last week and just floated the idea of, so what if we return back to a Blue Cross Blue Shield network just to sound this person out? And Lori, I don't know if your practice has picked this up yet or not, but this particular specialist said, we are hearing that in our area, they want to cut our reimbursement rate, Blue Cross, by 25%.
Yeah,
And they may lose a bunch of Mojave County doctors.
I know.
So I don't know if if that is reality or if it's rumor among the physicians, but that might
No, that's what
also-
we're hearing.
But when the work is done with, looking at different networks, it might be worth it to see, once again, is Mojave County gonna be singled out? Just so the Health Trust Board and the new contract administrators, the superintendents, have got a better feel for network reality coming.
It has nothing to do with Mojave County. It has to
Well-
do with every county in the state of Arizona other than Maricopa,
And-
Pima, and Pinal. Other than that, we are considered a rural area, and those rates are all going to be higher.
And that's where you can't
End
get
of
any
story.
physicians, and then you're gonna cut their rates.
But
No.
that, yeah, that's the point,
It
that
makes no
the
sense.
physicians
It's like,
don't
yeah,
have.
come
the
practice in the
physicians
rural
don't have-
county, but we're gonna pay you 25% less to do
Yeah,
it.
the physicians would not have an incentive to remain in any network if they're given a take it or leave it 25%
I'm sure it's not only Blue Cross.
decrease in reimbursement rate.
And
I'm
then
sure
that
it's
means
not
we'll
just
see
Blue
a
Cross.
flood
Right.
of doctors.
No, it's because
leaving
Medicare's
there.
threatening to do it, and they always follow Medicare's suit.
Right.
And it's the same with Apache County, Navajo County,
Mhm.
I mean, all those folks.
Yeah, all the rural counties, and I don't know why they think you can pay less, but,
Right.
you know, I mean, for years, my husband will compare fees with his friends that work in Chicago, and they will literally get paid double from Medicare for the same procedure. And he wonders why they're all retired. Well, they got paid twice.
Right.
What he got paid for it, and they're all retired, and he's still working. So,
And that's all tied to the lack of regulation on the
Yeah.
insurance
exactly.
industry, that
Exactly.
they can run the show.
But the government runs Medicare, so
That's true.
that's ridiculous. You should get paid the same fee wherever you are for this service, you know? And exactly, you should actually get paid a little more if you're out in the
You
boondocks.
should,
Yeah.
it should be that way. Are there
Okay.
any other, things that
Yes.
will help these people with their list of questions?
I would ask that you consider that we implement an FSA, a flexible spending
Yeah.
account.
Yes.
Okay.
The IRS has lifted the limit for this next year, I think 2,900, and that gives employees responsibility for their health care too, to spend it by the deadline. But it can be used for vision
Mm-hmm.
and hearing and your copays and your deductibles. It goes towards that and it's not taxed. And as an employer, you don't have to pay the FICA tax on that. So, I
That's a
think
good
it would be
idea.
a benefit if we offer that to our employees.
May I just help our new contract administrators with a very quick Reader's Digest condensed version on that? We had the FSAs up until 2 years ago. Our broker had indicated that the administrative cost was something like $2.50 a month per employee, and there were, I want wanna say 30 or 40 employees between the two districts that were taking advantage of it. So at the recommendation of the assistant superintendent, the Health Trust Board voted to recommend doing away with the FSAs. I was one of those who used the FSAs. So I think if you were to recommend bringing the FSAs back, we just have to really have a good education campaign to convince our coworkers and our colleagues the financial benefits of having one, so that the administrative costs of the FSAs don't outweigh.
Well, that's where the
No.
FICA comes in.
Right.
You don't pay
No, I'm talking
that
about.
portion as an administrator.
No, I'm talking about the district.
Yes,
was
that's
still
what I'm
having
talking
to-
about.
You
Their
also
cost
have to
of
do the
damage.
FICA match.
They're not, they don't have to pay the tax.
Then maybe it was the broker that was charging $245.
Who's the administrator of it?
The fees should offset. I mean, realistically,
Right.
depending on who you go with, who your vendor is on the FSA, the fees should, the savings that the district gets on the
FICA
FICA
match.
tax, the FICA match, exactly, should offset those fees.
Well,
That's part of the idea behind that.
and you know, I mean, if we're looking at all these increases, an FSA might be one way to tell employees, look, our co-pays are going up, but you can use the FSA and
See, 25%.
exactly, and it's before tax, so.
And you're right, your net won't be so gross.
And yeah, and it lowers your income tax rate too,
You just
because
have
you
to nag
won't gross as
employees
much.
by the deadline as well.
Right.
You have to
That's-
continually remind them.
Right.
Yeah, it's an
So,
education. for
Is
sure.
the HSA not the same as far as tax? It's not also pre-tax, HSA is not?
HSAs are
It
pre-tax.
is.
So an HSA is the same thing, except that you could take it with you when you
You
left.
have to be
Right.
and you
careful
don't have
though
to
if
use or
you've
lose
got
it.
very high medical costs though.
You can only use it on the high deductible health plans, so you can't use it on a PPO plan. You
Oh,
use
so they
it-
can't use it to go, okay, cause I was confused then in that last meeting, cause I was under the impression it could be used for purchases as long as it was related to medical.
You can't.
It is, but under the plan design for a HSA, you have to have an HDHP or a high deductible health plan, which is designed by the government basically to not have co-pays, not have co-pays for prescription, you're paying full retail.
Yes,
Yeah,
I looked through that.
yeah, exactly. So there could be a lot of surprise charges for the folks that go with a high deductible health plan and they wanna be on that HSA. Whereas if they're more comfortable, or if they have a lot of maintenance meds, maybe they'd be better off to be on a PPO plan that does have the co-pays, $30, $25 for a doctor visit, whatever the co-pays are for the prescriptions, and then they can use that FSA to help lower those costs, because those are, if you're taking maintenance meds, every month, I
Yeah.
spend X amount of dollars every month, I'm gonna add up the year, I'm gonna take off 10% to be conservative, because I don't wanna lose it, and then that's gonna be my election for my FSA.
Well, I think the point is that we have to have options for our
Sure.
employees.
Sure.
And so it may be that with the options, we only have, HSA has some real benefits for people who don't have medical problems.
Absolutely.
And it ends up having kind of a savings plan that people can take with them if they move to another job. The FSA may have benefits for other people. And we need to have a menu of choices for our employees, and then the districts have to decide which one of those choices the district is going to fund.
Right.
Okay?
So I think a good,
so we've got-
thing to
so
ask
that's
for
where we
too
wanna
is
go.
what their, if they'll give you a list of, expected physician fees.
True.
Because if they give you some physician fees, then I can see if they're cutting, based on what I know reimbursement is for, like right now, I have an $85 specialty copay, so they don't pay, like my dermatologist, they pay him $79.03, so every time I go, I have to pay $85 because I can't get them to understand, you're gonna owe me some money if you take my $85, but they take my $85 every time. So then I always have credit, so, because Blue Cross doesn't even pay the dermatologist what my copay is. So, we would be able to tell, like if the 25% fees are getting cut,
Right.
If cause I can go on and look up what the fees are, what the reimbursement fees are for multiple specialties on my program.
But the thing is, for most of us, we don't have that option.
I
Looking
know,
what those
I know,
are.
but I can look it up, so I can look it up and bring it.
Yeah,
We're
Michelle-
gonna start calling Lori and having her.
Yeah, you may get lots of phone calls, Lori. Michelle just.
I've had them before.
Michelle, explain that law that just got passed that doesn't take effect for another year. but
Yeah,
it's
it's-
gonna be useful for
I
one
think
for us
it
in a year.
went through the House but not the Senate yet, but it was the one where the hospitals are going to have to start disclosing what their fee agreements are with the various insurance companies, because if I can say, you're gonna get 75% of your bill paid with Aetna, but 80% with Blue Cross Blue Shield, but if their allowable amount is 20,000 and theirs is 5, I'd rather pay 25% of 5 than 20% of 80, you know what I mean, whatever the math would be.
Right.
So it's very hard when we're looking at comparing things, when we
Yes.
don't have those hidden numbers.
Right,
That's not an apples to apples.
absolutely.
Makes it hard.
When you don't know what their allowable is.
Right, I need to know, what is your allowable amount, because that's gonna tell me.
Cause haven't you ever seen the girl when you go
what
checking at the
percentages.
desk and she's getting your thing out and she's flipping through to tell you what you owe for the CPT code she's got? And-
Yes.
Yeah.
Well, that's why I
And
tell
the whole
people,
thing is-
you're like, what's the
Cause
pay
she
code, 1, 2, 3, 4,
knows.
5?
I'm like, can you run that off for me so I
Yeah.
know if I can afford
But
the
right now, they
memory?
don't have to tell us that, so it doesn't affect us immediately, but that's a really good thing for us to know in the future, is that they're going to have to tell us what their allowable is, so that if hospital A's allowable is 40,000 and hospital B's is your $5,000 example, if there's that big of a difference, then, then we would have more information to make good decisions as.
Well, and it's really important, we have been
Patients.
educating our employees that if, let's say I go to and I know my copay is gonna be 500, no matter which hospital I go to, right? So what do I care that hospital A is 5,000, hospital B is 10,000, hospital C is 15? What do I care? I'm still paying 500. The pool's taking up the rest though. So it does impact everyone. It behooves us to look at those dollar amounts and information to keep that pool lower. And as people start to understand that and how each person's choice affects everyone else, they're willing to look at that when they can.
Yeah.
They just have to have the information to start with to know to do it.
Yeah.
Can you check with VSP or the Cairo or whatever VSP to make sure that, or see if they can offer the same that Vision Care Direct is, where we can get contacts and glasses?
Yes, I already kind of looked it over. They are slightly more expensive per month, and instead of a 120 allowable frame, it's 150. Same thing with contacts. Whether or not they have a secondary plan, I don't know. That part, of course, I didn't get that far with it, but that was very similar. The dental, again, Delta Dental versus Emeritus, the same. Delta costs a little bit more, but the $1,500 allowable amount per year was the same with either one. The 100% for preventative, 80% covered for simple stuff, and 50% for, a crown or whatever, was the same with either one. So those kinds of things were very standard.
Okay. Was there anything else from any sites that they wanted to bring up?
If you think of things, please email, or if somebody asks you
And
a
if you
question,
could put it out
email
at your
John and
sites,
Michelle.
if they have
Please.
any concerns or problems or things they want brought up
Well,
before.
I still have someone that has major concerns with billing and fighting with Valley View, with the insurance, with billing, and I don't know if he's talked to you again. But, all the time, I'm still getting charged for this, or I'm getting charged for that, or.
I don't think they've contacted me because I only have one mail, but they wouldn't be at your area.
Yeah. Well, he's not necessarily at my school, but
Oh.
he was, but he's still, because I come here and
Yeah, I don't
he knows
think
I
they
come to
would.
all the meetings, so he say this, or, so.
Yeah, and
really, I
they
think
don't
that's-
handle the billing at this Valley View.
Yeah.
They don't handle it locally. Where is it out of now, Lance?
This week.
Yeah, that's exactly the question too,
When I
this
was
week.
there, they moved it to Las Cruces, and it was done by another Life Point hospital. And then after I left and came here, I believe.
It's in Havasu, right?
Havasu does some, but there are other aspects of the billing that have been parted out to a third-party vendor.
But there is somebody you can speak to in this hospital.
It's hard, even at Warmsey, it's hard to talk to a real person.
No, they won't
and-
talk to you here
No.
anymore, and they won't take money here.
No,
We were able to recently with one employee was able to, you know, because they were billing this person another $600, and I said, bring me your EOBs, bring me your bills. I looked through them, I said, they owe you 90, go back. And this person fought for a while. I think we had a 3-way call at one point between Valley View, Meritain, and the person, and he ended up getting that money back. He did not owe the 600, but it was a fight.
Yeah.
It was horrible.
See,
Yeah, hey,
that's something
my,
she shouldn't be doing.
yeah,
Right.
it happens to everybody. My husband was the chief of staff and got turned into collections from some MRI he had 6 years ago that my insurance paid for. And no one even called me. They said they didn't have our address. I'm like, what? He works here every week, you know? Yeah, no, it happens to everybody.
Right.
Yeah.
They're notorious for their billing, but so is Warmsey. Everybody's got it.
Exactly,
Yeah.
and I don't think that's going to change no matter what insurance carrier you're with.
Right.
You're still gonna run into
Yes.
those issues. People have to
Yes.
be prepared for that. That's not a magic
Yeah,
thing.
that's a problem everywhere.
But I think one of the things that we would like for Chuck, since you're the, one of the two, is how can we get how can we get some of those things handled,
Sure.
not by our people, but by, you know, a customer rep or somebody like that.
Right.
Because we know in the past, that used to be the case when we were part of a bigger consortium.
Yeah,
If there
you would
was
fax,
another
you would fax
individual,
those claims to someone and they
they
took
would
care of
take
it. And
Right.
that was,
So that's one of the things
a
we
dream.
know we want to have on that comparison list.
Right, absolutely. It's an education, but it's
Yeah.
really just being able to direct folks where to go and them knowing that they have folks that they can call that actually
Right.
they can, you know, our folks can actually see their claim right on the computer screen.
Exactly.
So we have instant access, so.
And that's not, it's not because Michelle doesn't want to serve
Right,
our,
exactly.
our employees, it's that she doesn't have that. So if we can, you know, if we can arrange with whatever carriers we have to take the
Right.
middleman out of that,
Absolutely.
you know, and get the direct service and it's kind of like filling out all the paperwork that Todd said, you know.
It's
When I
also-
came back on board in July, I had to put my name and address and phone number and social security number on 6 different pieces of paper. And it's like, why can't I just put it someplace once and they all share the same information? And that strikes me as, you know, that's time consuming for everybody.
I think too, Chuck, for the consistency and the reliability, because I know Michelle has told me on several occasions, they call and get one answer, she calls and gets another answer.
Right.
And that's really difficult to deal with because, you know, oftentimes they're getting the higher cost answer, and if they don't push one more time and make one more call, and I applaud Michelle and John for their efforts, because they make that second call, and they get a lower price, or they get a better answer than we're getting. I will say, in my instance, I went back and, not so much threatened, but I said, I have 450 employees that I will tell not to come here if you're going to do this to me. And they got rid of the $300 bill, and they took my $40 copay.
Sure.
But I had, you know, I mentioned my name, my position, and the fact that I was gonna be looking over 450 employees, and they were, oh, we'll take care of this right away, Mr. Flora. My employees don't have that kind of strength in their voice, but through Michelle and John, they actually have found that strength. But I want consistency as well
Sure,
between the two,
absolutely.
because it is
And
frustrating.
you should expect that. That should be part of any expectation.
Right.
So, absolutely.
all right,
Upcoming date.
upcoming dates of importance.
We already had a meeting scheduled for January 21st. And Todd and I are hopeful that that's a good date for y'all, so that, I think we had that on our calendar too, yes?
Okay. All right, does that date work for everyone?
So
It's the 3rd Tuesday.
Yes.
that's the day after Martin Luther King holiday, Tuesday the 21st.
And then in,
Permanent holiday.
what?
I'm on permanent holiday.
You are?
That's
And then in February, it's on the 25th.
That's the fourth Tuesday.
Mhm. Okay. If
And
there's
we
nothing,
will look- And we will look forward to having our 2 finalists here to present to you all next month, so.
okay. All right, there's nothing further, do I have a motion to adjourn?
I so move.
Second.
All those in favor?
Aye.
All right, meeting's
Thanks,
adjourned.
Brandy, for serving
Yeah,
as
thank you for all
proxy.
coming together on such short notice, we really appreciate it.
I
Thanks,
would
Chuck, for
assume that
being
on
here.
the 21st of January, January